My research is focused on understanding the diets of low-resource and food insecure groups in the United States. We're really interested in finding out how their diets are meeting or not meeting requirements, and then using that information to help improve programs that may already exist to serve those groups, or to create new interventions to improve diet and health overall, or to improve food insecurity. And finally, we're interested in new methods to use data and understand new things about diet and health relationships. The way that our research helps to support thriving and sustaining communities is that we're really interested in a lot of community organizations like food pantries and also programs that work through the community. And we try to first learn how they're serving their clients and how they're reaching their clients. And then we try to understand from that data new ways that we could maybe do a better job at reaching people who aren't served, or providing other kinds of foods and perhaps more healthy foods that could support and meet the nutritional gaps of clients. In my lab, we're very motivated by understanding that the U.S. food supply is so large and we could feed our whole population, but we're not reaching them with nutritionally adequate food. And so we are focused on trying to find ways that we can help to do that. And we also are very motivated by informing policy. And so those are the two driving factors that really push us to keep furthering our research and finding ways that we can help our population. I'm personally motivated in my research because of my experience of growing up in a small agricultural town in Indiana, where we did have a plentiful food supply and the community was focused on growing food for others. And then at other times in my life, like working in inner city Philadelphia and other countries like the Philippines, where a lot of the population did not have enough food, I could see the disparity, and I felt very compelled to try to use the skills that I have in research to help bridge those gaps. This research area is really important to HHS to help pull together those of us who are working to support communities and to build these links with organizations, not only in Indiana, but in the US and across the world. And this research area focus will help us to come together to think of new ideas, and we can put in research proposals to gain more money for these efforts.